we're back with another video in our 25 Days to Question Your Induction series with this wonderful book, Why Induction Matters by Rachel Reed. She runs a blog, Midwife Thinking. I encourage you to go check it out. And I'm going to be talking today about complications. In our last videos, I talked about the statistics from Perinatal Services BC, and I encourage you all to go out and check out that website. It is incredibly difficult to navigate. I agree. But there's a section, if you go to surveillance and then facility level indicators, you can go and check out all the different rates for the hospitals for maternity care in BC. You can compare them. You can look at the stats as far back as 2011 to 2012. And right now, currently, we're still on 2015-2016 statistics. It goes from April 1st of 2015 all the way to March 31st of 2016. My daughter's home birth was the very last statistic being done on perinatal services. So in the home birth rates for Abbotsford, my daughter's number is one of them. And I wanted to say, Perinatal Services BC, come on, please update soon. I really want the new rates. I know I'm still working through all of the information. I'm writing up all these reports as fast as I can. And the comparison reports will be put up in our files that you can check out. I have the folder, IB public files. They'll all be there. Right now we have 1 through 3. So we have deliveries in BC. We have deliveries in different health authorities. And I believe we also have the facility level deliveries, which is how many deliveries happened in the hospitals versus how many were done by midwives, physicians, and family physicians and obstetricians. And some of these hospitals in the Lower Mainland have higher rates of delivery by OB, and some have higher delivery rates by family physicians. And Abbotsford Regional Hospital has the highest rate in Fraser Health, tied with Ridge Meadows Hospital for midwifery care at 14% as of 2015-16. But Abbotsford Regional Hospital still has the highest induction rate in all of BC. So you also would like probably to look at that. And we also have statistics on Perinatal Services BC on vaginal birth for eligible first-time mothers. So low-risk women who probably should be able to have a very physiological birth. And then when you look at those rates compared to the induction rates, you can kind of see a pattern. So I talked a little bit about that in the first video. The other 3 videos were on informed consent and the decision-making process. And now I'm into the complications series. We have 2 videos so far on that. The first one covered hypertension, a little bit of gestational diabetes, and preeclampsia. And the other video had pre-existing diabetes and intrahepatic cholestasis of pregnancy, ICP. It's just called cholestasis on the Perinatal Services BC website. So you can look up those rates too of how many people are actually had those conditions and apply that to the induction rates and see if that really works out. I can tell you right now it doesn't. But when you have BC Women's Hospital having a lower induction rate than your own hospital, significantly lower, and BC Women's Hospital being a high risk facility where the special cases come from all over the province to deliver at BC Women's, that kind of tells you that something's going on. So if you haven't watched the videos on informed consent, I fully encourage you to go do that right now and then come back to these ones. We are going to be touching on my absolute favorite topic about induction of complications, IUGR. If you've watched some of the other videos, you'll know that my firstborn, my baby boy, was misdiagnosed and suspected to have intrauterine growth restriction, and that they basically talked me into having a hospital birth with him, which is where I can't be too mad about it, because if I hadn't been talked into going into the hospital birth and seen for myself what this environment really looks like for women, and the fact that women are not being told their options, and if I hadn't got good and mad, this might not exist, guys. If I had gone on to just have that wonderful home birth, I might have just said, oh yeah, birth was awesome, birth was easy, I loved it, I love it. But I wouldn't be aware of other women's experiences. And I wouldn't be aware of the problems that are in our healthcare system that is causing this environment and this trauma. And it doesn't need to happen. So my own trauma kind of pushed me to improving birth. And that's the same way for a lot of women that have jumped on the improving birth wagon. It's how it started in the States, and it's how I brought it here. So even though it happened and I'm mad about it, at the same time, I'm also kind of grateful, because it opened my eyes. It really opened my eyes to what's going on and why this is so important. So I'm going to be talking about the growth restriction, and if we have time, we'll talk about the pre-labor rupture of membranes, and if we don't have time, then that will be the next video. And then we'll be done with our complications series, and we'll be going on to variations. But growth restriction is kind of a big one, and I'm probably going to talk a lot about my experience, because I find that it's easy to connect when we also talk about our own experiences and not just what the numbers say, because numbers are not people. And when you talk to real women and hear their real experiences, it kind of gets you in your heart a little bit more, and you remember it more. So it says here, the term small for gestational age is used to describe a baby whose weight is below the 10th percentile for gestational age. Now, in my experience, my son, he dropped at 35 weeks. And the week that he dropped into my pelvis really low and caused me all the problems with my SPD and everything, symphysis pubis dysfunction, not so bad as with my daughter, but still pretty bad. I'm just going to get a little more comfortable here because I'm kind of hurting a bit. So he was measuring smaller than he had at any previous appointment. And the midwife said, have you gone for any ultrasounds? And I said, no, not since 20 weeks. She's like, well, I'm sending you for an ultrasound. And we're like, is something wrong? It's like, well, he seems to not be as big as he was last week. So we went for this ultrasound, and I didn't hear back for 4 days. I went on Thursday, it went to Friday, Saturday, and then Sunday night she called me. And I was already thinking, I'm getting my doula, I'm getting my home birth, I'm fine. Nobody said anything. And then she says, his stomach is in the 2nd percentile. Now, I don't know what 2nd percentile means at this point. I'm a first-time mom. So I don't know that 2nd percentile really just means that he's in the 2nd percentile, he's at the bottom of growth for babies at his gestation. So it's an average. They're going by averages. And I know that there's a lot of people that have bigger babies than mine. And there's a lot of people that may go earlier than me. And we all grow differently. We all grow differently at different rates. So if I'd known what percentile actually meant, I might have been like, well, I'm a late bloomer. I didn't shoot up in growth until I was 14, 15 years old. I look at my son, and he's 4 inches shorter than I was in 6th grade, guys. So percentile doesn't really mean much to me, because when I look at that without any other complications, I just say, well, they're just small. They'll catch up, because ultimately I'm not a very, very big person. So it made sense that if my son was planning to come out at 41 weeks, that he'd probably slow down his growth. The other thing with my son's ultrasound, and I actually read my records, I got my birth records, and my pregnancy records. And his head was in the 95th percentile for what he was supposed to be at for that age. My son's brain grew faster than the rest of them, and then the rest of them caught up. That's pretty typical. My son's got a big head. So if I'd known that, I probably wouldn't have freaked out. But it says some babies, SGA is caused by a growth restriction called intrauterine growth restriction. So I was just told that he was in the 2nd percentile and that he had a growth restriction. I was not told that he was small for gestational age. I was told that he had a growth restriction. And she said, you're probably gonna have to need an induction, and you might need a C-section because he's small. We're gonna send you for non-stress tests, and we're gonna send you for ultrasounds. We're going to do this. There was no discussion on what it meant. If I had read this little tiny chapter, and it's only like a page and a half, if I had read that tiny little chapter, I would have been like, okay, is he small for gestational age or is he growth restricted? Now, here's how you can tell the difference, okay? Growth restriction occurs when the placenta is not functioning effectively, and there's a reduced transfer of oxygen and nutrients to the baby. And this can be caused by a number of factors, including preeclampsia, which I did not have, an undernourished mother. I was eating all the time. I was not undernourished. Substance abuse and severe anemia. I did not have any substance abuse problems, and I had just taken a blood test not too long ago that said that my iron levels and everything were fine. My hemoglobin count was fine. I was not anemic. So I didn't have any of these risk factors. If I had known that these risk factors is what can cause intrauterine growth restriction, then maybe something would happen. And I actually did ask a question. I said, well, what exactly causes this? And she said, we don't know. And I said, well, what could I do differently? And she's like, you honestly can't do anything about it. And she didn't say what the actual risk factors to get this were. If she had said this can be caused by preeclampsia, undernourishment, substance abuse, and severe anemia, well, I didn't have any of that. So how could I have a growth restriction? So she said babies are increased risk of stillbirth. She did say that. Infant death and disability. However, the risks reduce significantly for babies that are diagnosed with IUGR. So if it's undiagnosed, those risks are higher than if you actually catch it. So the rate of stillbirth is 1.9% of births for babies with IUGR that's not diagnosed and identified before birth. The stillbirth rate for babies who are diagnosed with IUGR in pregnancy is 0.9%. If I had known it was 0.9%, I would have said this is less than 5%. And I know from my statistics that 5% is statistical significance, and anything under that is not statistically significant. So you can't really say that I'm going to be at a higher risk of stillbirth if it's only 0.9%. I would have had a home birth. So the diagnosis of IUGR cannot be made based on estimating the size and weight of a baby, which is what they did. Ultrasound estimations of baby's weight are not very accurate, and they can be more than 10% higher or lower than the actual weight. So it's possible that that 2%, the 2nd percentile, could have actually been off by as much as 10%, and he could have been in the 12th percentile. Or they might have even been even worse at guessing. They said that the scan wasn't even very well done. But I'm not happy that I didn't get that information. And there it says here that in addition, ultrasound weight estimations cannot distinguish between a normal, small for gestational age baby, which my son was, and IUGR babies. So they couldn't even tell the difference between my small for gestational age and IUGR. They just assumed he had IUGR. And it is incredibly frustrating to me that I was not told that they can't tell the difference on an ultrasound. Diagnosing IUGR requires a more detailed assessment of how well the placenta is functioning. Now, this is where I should have really been able to tune in. I wish I had known this. This assessment is carried out by using an ultrasound Doppler to measure the blood flow through the umbilical cord to the baby. They did that. They did do that, but they never told me what those scans said. They said he's still small. They said he may not tolerate labor well. Well, how's the placenta functioning? Well, it's fine for now. How's the umbilical cord? It's fine. They didn't tell me that if those things are fine, then it's likely he's just small for gestational age. They still really, really tried to push it on me that he could have IUGR and I may need to induce and have a hospital birth because he's not going to tolerate labor well. This is what was said to me for 6 weeks. From 35 weeks almost to my due date. This is what it was said to me. Until my other midwife called me at 39 weeks and said, I'm sorry that this has been going on. I just got back from my vacation and I'm seeing this in your chart and I don't think this is right at all and you can have a home birth. And I was already scared because I was not being told the information that I deserved to have. Like, this was my right to know this information, and it wasn't given to me. When I was lying on that, on the bed and having the Doppler, and the tech was just taking pictures and saying, oh, well, here's your baby's feet and everything. They weren't telling me that the reason they were also checking the sound of the umbilical cord and checking the blood flow was to determine whether or not he had IUGR or not. They didn't tell me any of that. And legally, they should have told me. So then it says down here, an umbilical Doppler is the only evidence-based method for determining the well-being of the baby and provides a good assessment to how the placenta is functioning. Unfortunately, there's no effective intervention to improve the placenta functioning. So if the placenta wasn't functioning, then I would have been like, okay, well, they can't do anything about the placenta functioning, so we need to induce. Okay, that's fine. But they didn't say that. And that's where informed consent is really, really important, guys. It's really important. Because if I had had that information, I would have made a completely different choice, and I would have had a completely different birth. And I wouldn't have had 2 years of trauma and have to go to a birth trauma counselor for it when I was pregnant with my daughter. And I probably wouldn't have stalled in labor with my daughter, fearing the hospital transfer that may occur because something might go wrong that's not really wrong, because I wasn't told this information, and I had to read it in this book this year to really get it and see what was being kept from me. This wasn't all on midwife thinking. At least I don't think it was. I didn't see it. If I did see it, I may have passed over it in my reading because I was probably reading about prodromal labor instead. But this is really, really upsetting. So the birth of the baby is recommended before the placenta functioning declines. Placenta was fine in my case. If placenta is not fine in your case, then that's IUGR. That's not small for gestational age. So then it says IUGR babies are at an increased risk of distress during labor. So induction may cause the distress of labor. This is due to the effect of the contractions on the placenta that's not functioning effectively. That makes sense. Every labor contraction interrupts the normal blood supply through the placenta temporarily. This is what I was told, is that labor may not be good for an IUGR baby. That's what I was told. I wasn't told that a small for gestational age baby is going to be fine. So, IUGR baby will often have lower amniotic fluid than a well-grown baby. My amniotic fluid levels were fine. So, they never once said anything about that either. The amniotic fluid protects the baby from the contractions. We know that. The problems of the IUGR baby can have in labor can be worse than an induced labor. Worse with an induced labor, where contractions tend to be stronger than spontaneous contractions. So inducing labor, bad, but still needing to be done because baby is... So basically I was being told that I'd have to induce labor, likely have a C-section, but this part really, really bothers me here. There have been no recent studies examining the outcome of IUGR babies following induced and spontaneous labor. However, old studies report that during labor, 75 to 95% of IUGR babies required a cesarean due to signs of distress. Therefore, NICE guidelines recommend the induction of labor is not appropriate for babies with IUGR, and in these cases, a planned cesarean will likely result in better outcomes. So that's why she said that I'd likely need a cesarean. But again, this was not an IUGR baby. This was a small for gestational age baby. And maybe not even that. Maybe it's just that when they drop, I measure smaller. Because with my daughter, I measured smaller. So we are at 20 minutes now. I'm not going to have time for the reduced fetal movements or the pre-labor rupture of membranes. I'll have to do that in the next video. But I wanted to share my personal story with this experience because it just comes down to information. This is why it is so important that these videos get out here into the world and into the feeds of every single mother who may experience something like this. Because if you measure small and they say that you have an IUGR baby and you really have a small for gestational age baby and your options feel like they're suddenly cut down, and then you later find out that you had a small for gestational age baby and you find out all this information that I just read, it hurts. Even when you know that things turned out okay in the end, it still hurts knowing that you could have avoided all of that stress and all of that turmoil. I cried every day until I got that call at 39 weeks from my midwife telling me that he didn't have IUGR. And even then, I went into the hospital to do the non-stress test up until my due date, just so they wouldn't try to talk me into induction. Because I couldn't trust at that point. I was scared. And I was really scared in the hospital that they were going to cut me open because my baby was taking too long to be born. I pushed for 3 hours. Of course I pushed for 3 hours. They put me on my back. They pulled me from the tub. I know it was hospital policy, and I know my midwife's hands were tied, and I know she did everything she could to try to reduce the trauma, and she knew what the environment I was walking into was like, and she didn't want that for me any more than I wanted it for myself. But I didn't have the information. I didn't have it. And that's why it is so important that we let everybody know that this is happening and what our options are, and informed consent and refusal, and decision making, and how to make decisions, and how to weigh the evidence, and what the evidence actually is. Because it's not being told. I was not told. And I even sent a letter to the College of Midwives, I believe it was, in the complaint section, and I complained. And I got a letter back saying, well, this is not what your records actually say. Well, they said that my records say that I was fine with having a hospital birth, and I was not fine with having a hospital birth. I asked at every single appointment, well, what if I just have a home birth? And I kept being told, one of the things that I will always remember that really, really sold it to me that I should just have a hospital birth and just give up was when I was told that most first-time moms end up transferring from home to hospital because they need help or they can't handle it. So when I when I was told that you'll probably, basically what I heard was you're probably just going to end up in the hospital anyway, so you might as well just go to the hospital, is what I heard from most first-time moms, chances were. And if I had been told, you know what, you probably don't have a small for, you probably don't have an IUGR baby, you have a small for gestational age baby, you probably won't go at 40 weeks, you'll probably go at 41 weeks, which is still normal, and baby will still be fine, and labor will be fine, and you could probably have a home birth, and it would be wonderful, and you would, and I will support you. If I had heard that, he'd be born at home. I'd have 2 home birth babies instead of 1 traumatic hospital birth baby and 1 home birth baby. But then I can't guarantee that improving birth would be here. Unless I had met up with Christine and said, you know what, this isn't right, what happened to you? And I probably would have. But the reason I met Christine and we became good friends was because we were all in the same trauma group. And I went to the midwife drop-in, and my midwife said, are you going to stay for the birth trauma? And I said, well, I don't think I belong there. And she said, what do you mean you don't think you belong there? And I'm like, well, I had a vaginal birth. I had it without unmedicated. I got what I wanted. I just didn't get a home birth. And she said, if you feel that the birth was traumatic, then it was. And I will never forget that. Thank you so much, Jules. Thank you so much. Jules Atkins, she was amazing. I will shout out to her right now. Jules Atkins, you put me on this path, and I thank you so much. I don't know if you're still practicing or if you've retired now, but you changed my life, and you put me on this path, and I will never forget it. So share this video. Reach out if you've got a midwife that touched your life, or a doula, or even an obstetrician that really went above and beyond and gave you informed consent, and let them know, and let others know that birth trauma does not have to happen in our system. Our system is broken. It needs to change. We cannot keep doing this to generation after generation of women. We can't. We need to change things. We need to go back to birth being empowering. No matter if you have a cesarean, no matter if you have an induction, no matter if your labor is augmented, no matter if you have a home birth, no matter if you have a free birth, it needs to be empowering to you. You need to think, this was my decision. I did this. I weighed the options. This was the outcome. I own the outcome. Nothing was done to me. It was all done with my consent. Because if it's not done with your consent, then it's not right. You had the choice, and they didn't give you the choice. It was taken away from you. You were robbed. So instead of getting angry at other people who have the amazing birth experiences, and instead of getting angry at the information that's being given to you, get angry at the system and help us change it. Share this video. Have a good night, and we will see you next time. Bye, guys.